Muchas gracias. Antes de empezar, les vamos a pedir a todos que por favor mantengan sus micrófonos silenciados. Hay una aplicación ahí donde ustedes pueden en el chat hacer todas las preguntas que quieran a nuestro invitado hoy. Todas las preguntas las vamos a revisar al final de su charla. Okay? So, welcome everybody. Before we start, I'm going to ask you to mute your microphones. And please, if you have any question, please write them down in the chat room so we will go over them by the end of the webinar. Okay, so we will start now. Good afternoon or good morning, depending from where you are located today. It is an honor to introduce our speaker today, Professor Chunhuei from Oregon State University. Dr. Chi graduated from Harvard University and is the director of the Center for Global Health at Oregon State University, where he is also a professor in the College of Public Health and Human Sciences. He is a policy advisor for the Ministry of Health and Welfare in Taiwan. And lately, he has been very busy talking about COVID-19 in mass media interviews and seminars. He is also my mentor and one of the most inspiring persons that I have ever met in my professional life. So, Dr. Chi, welcome to our webinar.
Thank you. Can you hear me?
Yes.
Okay. Good morning or good afternoon, depending on where you are. It is a great pleasure for me to share some of my observations and knowledge with everyone. And some of you might have seen me last September. That was the most recent time I visited the school. And also Alicia arranged for a talk I gave last September at the University of Chile. So today, I'm going to share with you with the topic managing COVID-19 control and how we balancing between population, safety, and economy. And my talk is divided into 5 sections. So a quick overview of the pandemic, and then a summary of how the global responses and consequences has been. And then I will going to introduce that has been called standard by media, how Taiwan effectively control this epidemic. And then on the 4th section, this is currently a very hot topic everywhere. People are talking about when can we reopen our economy and daily activity safely. That's the 4th part. And then the last part I will conclude with looking forward the day after this pandemic, the global impact and how we adapt to it. So let's begin with a quick overview of how this pandemic all started. A key timeline about how this started. And the latest data suggests, this also came from a research published in China. The first case identified in Wuhan, China was in November 17. And then on December 30, 8 physicians in Wuhan, they were among the first ones sounded the first alarm. But unfortunately, they were being silenced and being arrested on January 1st. And one of them eventually died from the COVID-19. December 31st was the first time China sent its National Health Committee to investigate in Wuhan. That's the same day so warned the WHO International Health Regulation on the possibility of this new human-to-human transmission of this novel coronavirus. But unfortunately, WHO did not take any action at that time. On the same day, Taiwan also started the first action, begin the onboard inspection of all passengers flying from Wuhan to Taiwan. We will wait 3 weeks or so. China officially announced this disease is transmitting between humans. And finally, on January 30th, WHO announced this disease as a public health emergency of international concern. And then it took a half months to announce it as a pandemic. And this is the pictures of after China locked down the Wuhan on January 23rd. And in this next chart, we can compare in terms of its mortality rate as well as basic reproduction, or the R naught. And this is where COVID sit right here between influenza, HIV, and SARS. Early on, in some countries, including United States and Europe, there was some misperception about COVID-19 that also resulted in under responding, because some people, including some policymakers, mistakenly thought this is just another flu. As we now all learn, this is far more than just a flu. This is an enlarged scale. We can see where COVID-19 stands compared with flu and HIV. And based on an autopsy study in University of Wuhan Teaching Hospital, this was in March 11th. The researcher and physician in China, they found a patient who died from COVID-19 has the combination of the impact of SARS and AIDS. So the lung damage is a typical sign of SARS damage. The immune system damage is a typical symptom of HIV/AIDS. And then on top of that, they also found multiple organ failure. So this is from a more severe infected patient who died. And one of the key issues about how contagious this disease is the R naught. And on the right-hand chart, it shows if R naught is 0, then the disease will quickly decline because it will not easily spread to others. If R naught equals to 1, then the disease will be stable but not spread widely, because every person on average can only transmit to one person. But if R naught is 2, meaning on average a person can spread to 2, then it can quickly spread throughout the community. And so far, the researcher has found out an estimation. We will never know in a short time the actual naught. This is an estimation. It's between 2 to 3.11, and the scenario is like here. That can make it spread very quickly. A quick overview on the nature of this COVID-19, and one important thing to keep in mind is this is brand new disease, and we are still under limited knowledge. And as they go by, we continue to learn new things about this disease. I'm going to briefly touch on the global responses and the consequences. This is a frame of pictures has been shown and printed multiple times, showing that how the Director General WHO Tedros met China's President Xi Jinping. After he met him, that when he decided to declare it's a public health emergency. And in this picture shows the dean, Dr. Gabriel Leong. He's the dean of Faculty of Medicine from University of Hong Kong. And back in late February, in early February, he predicted April will be the peak around the world, and he predicted that quite correctly. And he also estimated in Wuhan alone, this was in February, there were about at least 75,000 people infected. And this next chart shows how that disease spread starting from Wuhan to other part of China and then throughout the world. I used 3 countries model because those countries were the earliest one to get hit by the COVID-19, and also the country took the earliest action, and they took very different type of action. That's why I want to use these 3 countries as a model. And I highlighted what's unique to them. For Singapore, Singapore was the first country to use very strict social physical distancing and with very clear guideline and restriction and even fine. Singapore successfully contained the spread. Initially, was containing very well, but then in February, one of its religious leaders single-handedly spread to over 1,000, and that caused a huge community outbreak. So when they already have a community outbreak, they have to take a very different approach. And so South Korea kind of developed the first mass testing. They test millions of South Koreans and was able to eventually to contain it. So South Korea has the excellent model, being the first country that initially faced a massive outbreak, community outbreak, but was able to contain it. And Taiwan shows a complete different model because Taiwan was took action to contain it. So since the first case, January 21st, never had any community outbreak. And later, I will specifically explain the method Taiwan used that how some other countries can adapt or learn. And one of the unique approach Taiwan did was precision tracking and I will explain more detail about how Taiwan did it. So Taiwan, unlike South Korea, did not do a mass testing. Instead, they do precision tracking and testing all the people that need to be tested. And this is feasible only when the country has very small number of cases. But once you have a massive outbreak, you can no longer carry out this precision tracking and testing. You have to do what South Korea did on mass testing. And there's been some debate and discussion of what type of system or government are more effective in controlling the pandemic. So in this chart, it shows the light blue are the non-democracy, the dark blue are the democracy. And there are mixed results because both non-democracy and democracy, depending on how government took actions and what kind of action government did, there's a mixed result about which one tend to be more effective. Trend line shows the democracy seems to be slightly more effective than non-democracy. And this is the comparison case fatality rate around the world and versus the median age. So you can see the pattern on the far left. The yellow represent Africa. So it is striking that in Africa, the mortalities tend to focus on the young, very young age, like 20 or even below. Whereas in Asia, Asia has a high concentration in that between 25 to 35 range. And then Europe and North America tend to have a concentration in terms of age, the fatality in a little bit higher, above 35 and older. So this is fascinating how this disease attack people in different age group in different continents. And so far, South America seemed to have the similar Asia that concentrated in the age group between 25 and 35. And this is another comparison, is the world, a comparison of case fatality rate. Italy has among the highest is nearly 13%, and Iceland has the lowest, and the world average is around 7%. So the world average give us a reference point, 7% case fatality rate. So last night I constructed this table to show comparison. Here in the blue, Netherlands in the orange, Taiwan in green. So these three countries has a comparable size of population. And these three countries where their size of population is comparable, but very different result. So it seems Netherlands is suffering the worst spread with the highest number of total case. And Chile is kind of in between. And this is the total case as of today. Taiwan has only 429 cases. And again, in terms of the top, Netherlands also suffers the most. And Chile seems to be doing relatively well in terms of the deaths. And Taiwan so far has only 6 deaths. And in terms of case fatality rate, Netherlands is way above the world average of 7%. And Chile seems doing very well in terms of case fatality rate of 1.44%. That's comparable to 1.4%. And then in this row shows the case per million. Again, on average, there are 2,223 cases in per million in Netherlands. And Chile is right in between, and Taiwan is 18 per million. The last one is the one I pay a lot of attention, is the daily new cases over the last 7 days. So Chile is between 473 to 552, and Netherlands has a wider range, and Taiwan has between 0 and 1, and including today, Taiwan has a 4 consecutive days of 0 new cases. And here is a humor related to COVID-19. I'm going to share with you Taiwan's experience. Last Sunday, New York Post published a paper, published an article showing how Taiwan, actually in this article title, it says, of all the countries in the world, Taiwan is the only country the right thing in containing the COVID-19. So I'm going to share with you some of the highlights. And the gold standard was the title of the British newspaper, The Telegraph. Here are some articles that including the appraisal of Taiwan's approach. And to look into the Cambridge Core Broke, it includes 30+ countries' response, including Chile too. So this is the latest chart I just constructed last night because Taiwan is ahead of Oregon. So last night I already get the data for today's data in Taiwan. So the total case 429. The blue line shows the cumulative case at 429. And the reason this peak was those imported cases that during this period of time, they were estimated 80 to 100,000 overseas Taiwanese returned to Taiwan. They brought those cases back because they feel Taiwan is one of the safest places in facing the pandemic. And that's why there's a peak of this, let's show that the peak of daily new cases. It's a small peak, and that was caused by a naval fleet that just returned to Taiwan. And otherwise, for the last 4 days, it has been 0 new cases. This slide, I summarize some of the key measures and policies. The first one is Taiwan has an effective leadership with strong national coordination, and particularly Taiwan's activated the Central Epidemic Command Center that has the one of the highest power to coordinate all the ministries. And so Taiwan can have a very effective coordination. Despite Taiwan as a democracy, it has a very effective coordination. And the second factor is Taiwan has a strong infrastructure. Taiwan has been preparing for this pandemic for 16 years because Taiwan burned, I mentioned here, burned very badly in SARS in 2003. So immediately at the end of the SARS, Taiwan built up this command center. And anytime there's a major outbreak, they activate that. So this time they activate that command center a day before Taiwan had the first case. And that strong infrastructure besides universal health care. Since 2003, Taiwan has been training all hospital nurses and physicians how to respond to highly contagious disease. So they were prepared for 16 years. And that's part of advanced planning and advanced deployment. Later, I will show you the example of masks. And then because Taiwan, most people in Taiwan experienced the 2003. So they are very cooperative and compliant with government regulation and restrictions they know that's for the public's safety. So Taiwan shows the strong social solidarity. And then Taiwan was the first country to invent the precision tracking and testing at the end of January. And the information technology allowed Taiwan to do that. Then there's a transparency in decision and policies that despite a lot of rumors, but Taiwan's Command Center daily briefing can help fend off those rumors. And ironically, Taiwan is not a member of WHO, and that fact in this pandemic actually helped Taiwan because early on, WHO was very slow to respond and sometimes with wrong information. And Taiwan's quarantine is also of very unique. On the right-hand chart, I show the consequence for each run of infection. No quarantine. If on average one person can infect 3, then by 10th run, that person can infect nearly 60,000. If we quarantine 2 out of 3, by 10th run, it's spread to 1,000. If we are able to quarantine 2 out of 3, by 10th run, it can only spread 1 person. In the absence of vaccine, quarantine can serve the function of quarantine. So Taiwan has 3 levels of quarantine depending on the contact history. And Taiwan used digital electronic fence system to monitor, and that is based on individuals' cell phone signals. Use that, they can coordinate the monitoring by public health professionals, government officials, and police departments. And the quarantine under Taiwan's public health emergency law for contagious disease, the entire cost are public finance. Individuals who are under mandatory quarantine, they don't have to pay the cost. The government pays the cost. And then people under quarantine cannot use any public transportation. The government has contracted quarantine taxi that they disinfect after each passenger. And so that's the only transportation people under quarantine can use. Some shows how Taiwan did on quarantine. So this is a care package giving out by, and so a person under mandatory quarantine, this is inside the care package. This is a pack of 14 surgical masks, and then lots of snack and food, and book for reading, and even vitamin B2, B6. And then they even have access to free movie for that 14 days and access to free exercise programs. So this is all included in that package. And the entire quarantine costs are financed by the government. Because Taiwan has successfully contained this COVID-19 from the beginning, so Taiwan's economy still being affected, but compared with all other nations, has the minimal impact because to this day, all schools remain open. People go to school every day. People still go to work every day. All restaurants are still open. Even movie theaters are still open, and bars are still open. Only thing closed are the discos. And professional baseball was temporary, but on April 20th, Taiwan was the first nation in the world to reopen professional baseball. But live audience, so they put those figures on the audience seat, and audience had to watch the game from their home TV. One of the success story of Taiwan in early planning was mask. On January 24th, after Taiwan had only 2 cases, Taiwan immediately banned export of N95 masks. On January 30th, our government mobilized all masks and monopolized all masks, prioritized masks for medical professionals, health institutions, and ration to the rest. January 31st, government immediately invest $6.8 million to build 60 new mask production lines. On February 6th, the public rationing of masks started. So Taiwan became the first nation to have universal access to masks. Initially, two masks per adult and 3 for children per week. This was increased to 3 pieces per week, and most recently to 9 pieces per 2 weeks. And at the beginning, in January, Taiwan's daily production of masks was 1.88 million per day. By now, Taiwan is 50 million per day. So that's not only enough for the domestic use, but also Taiwan began to donate masks to various nations. The rationed mask has multiple ways. People can order online. And here I show a picture of a vending machine. People can go to vending machine using their ID card to purchase the ration mask. And the ration mask is sold at cost 50 US cents per mask. And the picture shows the variety color of masks. People can color coordinate with their dress. Did a very meticulous tracing of every single case, how every single case received the virus from which source and how many people they have contacted. So this is a key strategy leading to Taiwan's effectiveness control. With precision testing, they identified potential carrier and they quarantine them, control the spread, then they minimize the prevalence and case fatality rate, then they suppress the pandemic. And here are some of the leaders. I call it the dream team because the vice president of Taiwan happened to be an epidemiologist who got his PhD in epidemiology from Johns Hopkins. And many of the leaders happened to be either physicians or public health professionals. And that also helped Taiwan to design a very effective policy. And Taiwan has a cell phone app to provide daily information update information because Taiwan, like many countries, suffer from rumors. Picture shows when Taiwan evacuate Taiwanese citizens from Wuhan, they even provide every passenger protective suits, shield, facial shield, and mask. On the first section, I'm going to talk about how do we balance public safety versus economy. The International Labour Office identified key policy framework. Its 3 main focus: protecting workers in the workplace, stimulating the economy and labor demand, and also support employment. So these are the 3 important pillars that International Labour Office recommend how every country hit by the pandemic and protect their economy and their workers. In this next slide, I summarize some key measures any country considering reopening economic and daily activities, they should be prepared. So the first one is, earlier I mentioned, the daily new cases should be very low because that's a good indication that the spread has been suppressed. And then the second important condition is the country is well prepared to have surplus capacity for hospital and health professionals, that just in case once you reopen the economy activity, when the cases resurgence, you have the capacity to deal with that. And also prepare adequate capacity for contact tracing, testing, quarantine, and medicine and equipment, especially the personal protection equipment and ventilators. So these are the preconditions to open the economy. Then once the economy is open, again, here are some important key policy measures. One is extensive contact tracing and testing, because this is Taiwan has been doing all the time, but a country can do that only when the cases are low. When you have a massive outbreak, you don't have the resources to do that. And then the aggressive treatment, isolation, and quarantine for anyone affected. And an important factor is mandatory mask wearing in indoor public places and public transportation. Again, in the absence of effective vaccine, masks serve the similar function of vaccine. And then the reopening should be incrementally, not a sudden suddenly open with restrictions, particularly reduced indoor maximum occupancy, then aggressive monitoring new cases. Picture I'm sharing with you showing how Taiwan never closed any restaurant. Well, restaurants remain open. They took some measure, for example, those plastic shield to prevent the droplet from spreading. And this is an entrance of the restaurant. Every workers wear mask, and they have a temperature measure. They measure every customer's temperature as they enter, and this is alcohol spray. They spread on every customer's head. So these are the kind of measure we should anticipate it once we reopen our activity in the economy. Similarly, this is how Taiwan maintains all schools open, from elementary school to college. Every school remains open. And this is during lunchtime. They use the plastic shield to prevent the spread of the droplet. This is the entrance of a school, a middle school. The teachers, the staff, they are measuring every student's temperature, every student and teacher wearing mask. This is the elementary school. During the class, every student wearing mask. The last section, I'm going to talk with you about how do we anticipate the day after this pandemic. Of course, we are already being impacted, particularly the economy. And I've been looking into the International Labor Office's statistics. The vast majority of countries suffer significantly from the downturn of economy to the unemployment. And one of the keys is the disruption of the global supply chain. That not only impacting our current, but will have a long-lasting effect after this is over. And this is the chart shows how different sectors are being impacted and how each sector presents the total percentage of the economy. On the right hand, the dark red shows the sector that are hardest hit, the wholesale, retail, manufacturing, arts. On the left, the blue, the green are the sectors that has relative lower impact. Again, this data comes from International Labor Office. This is an example of how the supply chain being disrupted, and this example of U.S. meat, pork and beef. And over the last few days in the news media in the U.S., we have been hearing a lot of disturbing news because of a lot of factory workers are being infected. They have to shut down. And then there's lots of farmers who have cow and pig. They cannot process and slaughter many of those cow and pigs because they cannot ship them for processing. And this shows the trend of the price. And the magazine, The Economist, has an article showing about the high risk factor of how the coronavirus impacts the economy. And I'm just going to focus on the high risk. The high risk include the employee disruption, supply chain disruption, and reduction in demand and idle capacity. So these are the three major factors we need to mitigate during this pandemic, as well as once we are over this pandemic. This chart also shows the impact of the global economy. Most countries will be facing a negative economic growth. And this chart shows the disruption globally. This is a quote from the author Robert Malley, who COVID-19 has laid bare the cost of confronting a global crisis with a flawed international system. So the only worst outcome will be to confront the next crisis with no system at all. So what lays ahead the day after COVID-19 pandemic? First, every country will be re-examining the global division that will be a shakeup because we are so dependent on that when we were hit by this pandemic, suddenly we are all vulnerable, our supply chain being disrupted. And so the supply chain stability and risk will become a hard issue. Every country have to deal with it. Related with that is divergence of globalization and localization. And this pandemic demonstrated that re-emphasizing the important role of nation state. Despite we are a globalized world, the nation state plays a vital role dealing with the pandemic. And then the other factor is pandemic-oriented strategic plan. How can we rebuild our economy so it's pandemic resilient? And also impact our urban planning because the way we construct our development of urban environment make us very vulnerable to a pandemic like this. So many policymakers and urban designers are going to rethink the resilience. And the other issue is strategic industries. The strategic industries that's vital to contain, to control pandemic, such as mask, personal protection equipment, and drug, etc. And then the next, let's look at the world. We'll have to restructure our public health and global health system because this is a failure of both global health system and public health system, how we got into this place. And the failure of the neoliberalized society. And Noam Chomsky commented that the neoliberal social system prevented the development of vaccine after the 2003 SARS. And then we are going to read the significance of state versus market. This pandemic shows the free market alone cannot deal with it. We need a strong state to help us deal with the pandemic. And we need to reimagine the pandemic, post-pandemic world order that's going to shake up our economic structure, health system structure, and how we collaborate with each other. What kind of world we want to move forward rather than return to will be a big question. I encourage everyone to give a serious thought on that. And this is one of my favorite quotes, particularly pertinent to the pandemic. This is a quote from Albert Camus, The Plague. The only way to fight the plague is decency. Let us imagine after this, and that concludes my presentation. Thank you very much.
Thank you, Dr. Chi. Thank you so much for your talk. So now we have a lot of questions from the audience. So let's talk about some of them. So Magdalena is asking you if you can comment about lung damage in the case of people who have been cured. Is there any visible damage? What do you know about lung damage?
In terms of lung damage, it varies. So I can give you a statistic in terms of the consequences of infection. Again, given this is a new disease, all statistics are temporary because they will be continued to be revised as we learn more. So far, what we know is roughly 30 to 40% of the people infected will be perfectly healthy and no symptom. So those people, and researchers still try to learn why some people are infected but perfectly healthy with no symptom, no any damage. One thing in caution is people who are infected with no symptom, the technical term in epidemiology is called asymptomatic. The asymptomatic are equally contagious. And then only about 20% of the people who are infected will have severe symptoms. And those severe symptoms will result in fibrosis, the permanent lung damage for those. But these are some small percentage compared with the rest.
Okay, thank you, Dr. Chi. So Rodolfo also asks about what do you think of Paul Romer's massive COVID-19 testing proposal. Is it really utopia or can it work?
Are you talking about the poor performance of testing?
Yes, the testing proposal from Paul Romer's. Mm-hmm.
The testing is a very contested issue. As I mentioned in my slide, there are two models of testing. One is the South Korean model, because South Korea is the first country to do a mass testing. That's probably somewhere closer to Paul Farmer's idea, mass testing. But mass testing requires a lot of resources that many middle low-income countries, even some high-income countries, don't have that kind of resources. It's not just the testing kit. The testing kit itself is expensive too, but you also need staff member, the health professionals to carry out that testing. So mass testing, well, it's helpful, but it's very resource demanding. And ideally, it's a combination of mass testing and precision testing that Taiwan has been doing. And personally, I would advocate emphasizing more on the precision testing, meaning contact tracing. You trace all the people that have been in contact, in close contact with confirmed case, and then test those people rather than randomly test all population. And that's one big problem of relying on mass testing alone. Because let me give you an example. Let's say even if you have the resources, you test the entire population of Chile. Chile has about 20 million. Hypothetically, if we test the entire population of Chile today, what are you going to do next week? Because if you test everyone today and you find that, say, only 5% or even less than 5% have it, unless you are going to effectively quarantine them, even if you effectively quarantine those 5%, you still don't know. Not all testing 100% effective. There's no any testing 100% effective. Some testing are better than others, and what most countries are looking for is at least 95% sensitivity. And even if we test everyone today, 1 week from now, we're going to do that again. Because people don't have disease today doesn't mean people won't have the disease tomorrow. So for that important reason, I personally disagree the mass testing as an effective control measure. The precision testing is far more important than mass testing.
Okay, thank you, Dr. Chi. So another question, Magdalena. She's asking if you can comment on a non-natural origin of this virus. She said that the virus, well, some people have talked that the virus comes from Hubei and it is related with research on baths. So if you have any comments about this.
There are contested theories about the origin of this disease. And policymakers and researchers are still investigating it. So I don't have a confirmed answer. Early on, the source from China indicating the origin of the virus came from the seafood market near Wuhan. But that theory has been refuted by another team of Chinese researchers. A team of Chinese researchers published their research sometime in February, which they collected patients, and I don't know the percentage, the very high percentage, like 30 to 50% of the patient sample they collected in their study has never been to that seafood, has nothing to do with that seafood market. So the seafood market as a source of the virus has been refuted by Chinese researchers. So that's opened up about where it is. And one theory Again, this is just a theory. Is the virus might be an accidental leak from P4 lab, also happened to be in Wuhan. And P4 lab is the highest level of biological lab with dealing with the lethal viruses and bacteria. And China has only one. It happened to be in Wuhan. So these are theories about the origins. And it will take a while to identify which source is more likely to be the origin of this virus.
Okay, thank you, Dr. Chi. So Juliana also want to know about how comparable are the numbers of cases between countries if the numbers depends on the number of tests carried out in each country.
That's a good question. Because every country, even say within South America or within Europe, within Asia, the contact tracing and testing, the level of that varies across country. So the country that does more testing on average will find more cases, whereas country that did fewer testing will have fewer cases. And one classic example is United States. The reason United States has become one of the worst nation to face this pandemic was for about 6 weeks. From late January, US has the first case the same time as Taiwan, but US did nothing, almost nothing for that first 6 weeks. And I was shocked to find out until the beginning of March, the whole country of United States with over 300 million population only tested 472 cases. Only 472. And because so few were tested, so throughout February, it shows security, or sense of security. US has very low cases in February. And then it exploded in March. That's an example of how comparable is the cases. So that's a good question. And one indicator, not necessarily accurate, but a good indicator to compare with cases is mortality. On average, again, this is just on average because there are exceptions. On average, if a country doesn't do a good job in testing, that means that country on average allow the disease undetected to continue to spread. Then over time, that country is going to see more fatality. This is exactly what we have seen in Italy and in Spain. The two of the worst countries suffered in Europe. Initially, they were not doing much testing. They let the disease spread undetected. Then after a few weeks, you see the fatality spike. So yes, that's a good question. We have to be cautious in interpreting the cases, but by supplementing with other statistics, such as the case fatality rate.
Thank you. So Giheli, and I'm sorry if I mispronounce your names, ask if you can summarize the pros and cons of belonging to the WHO. So this one is a controversial one.
Yeah, that's a good question.
Yeah.
Well, I have been a strong advocate and supporter for WHO as a global leader in public health. But how well WHO perform that function is highly dependent on its leadership. This is unfortunate. A democratic organization should be highly, its function and performance should not be highly dependent on its leadership. And unfortunately, that's what we observe. So I would have to say, well, I'm a strong advocate and supporter for WHO as an organization. Very disappointed at current leadership because it, from the beginning in January, it continued to delay the announcement. And one critical issue was Taiwan warned WHO on December 31st that this disease potentially transmitting from human to human, the WHO wait another 20 days to announce that this disease was transmitting. And between January 20th, there were other countries raised the warning. Taiwan was the first in December 31st, but then there were other countries raised the warning. Every time before January 20, the WHO director keeps saying there is no evidence that this disease was transmitting from human to human. But in January, I think 23rd, at least two publications from China, from China's CDC teams and their researchers, kind of refuted both China and WHO's earlier claim that together with WHO, China was also saying officially up till January 20th, this disease was not transmitting between humans. But the two publications, including one in New England Journal of Medicine in around January 22, 23, show Chinese researchers collected 450 patients. They analyzed their study based on those 450 patients. And guess when did they start to collect those patients? December 1st. So if the disease was not transmitting between humans, how could they collect 450 patients starting from December 1st? In their method section, they also said more than half of the 450 patients were collected in December. So these are hard proof showing how WHO has been so slow to respond. And WHO is partially responsible for this pandemic, for its slow reaction. My answer, I support WHO as a function, but I'm very critical of the current leadership for being so slow to delay the response. And that's why I say Taiwan being benefited from not being a WHO member because Taiwan didn't have any information from the WHO, and Taiwan did not trust WHO's information. Taiwan took the action to its own.
Thank you, Dr. Chi. So Magdalena also wants to know your opinion about linking COVID-19 with other diseases like tuberculosis. There are some reports that vaccination prevents some cases, especially tuberculosis.
Yes, I have seen some report on that, but at this moment, we are still too early or premature to confirm that because researchers are still investigating similar issue. Besides tuberculosis vaccine, similar issue is immunity. That early on, UK, the British Prime Minister Boris Johnson, back in early March, decided the British government was not going to take any action. They were going to let people infected and then create herd immunity. Sweden is doing that too. But now there's a kind of discouraging news. We actually have this information early in February, but back then we didn't have adequate information. In February, a few cases in China and in Japan shows patients who are infected and cured, recovered, but a week or 2 weeks later, reinfected. So this was happening back in February. But last week, South Korea showing relative, compared to a few handful of cases, South Korea, a larger number, I don't remember the exact number, but much larger number than the February, of patients who already infected and cured, recovered, are being reinfected. So there's a big question about how long the immunity will be effective. And that information will challenge those leaders who are thinking about creating herd immunity, because that is remain a question.
Okay, thank you, Dr. Chi. So Rodolfo now have a question about how much state intervention is required in an economy against a pandemic like the coronavirus, and what relevant ethical questions does the answer to this question involve?
So let me rephrase that. You're saying the question is how
state involvement, yeah, and
involvement,
ethical
yes.
concerns.
Communicable disease is a classic case of the economic term called externality. And externality, for those of you who did not have an economic background, it means one person, one party's action will impact others. And any event, any activity that possess high level of externality will lead to market failure. And communicable disease is the classic case. And this is why eventually US also, despite US is a capitalist free market system with free market healthcare, eventually the Congress legislate that all testing and treatment of the COVID-19 has to be covered. And Taiwan already has a universal health care, and also under its public health emergency law, even visitors, Taiwan had a few visitors who were also infected. They brought the case to Taiwan. Even visitors are covered, their treatment and service quarantine are covered by the government. Because the externality nature of it, let me just give you one simple example. If a poor person infected, and that person is so poor, he or she cannot afford to be treated, what the society is going to do? Because if this is not being treated, this poor person possesses a huge risk to everyone else. And so COVID-19 is a more of an extreme case of externality. And that's why I commented a highly contagious disease, especially a pandemic like this, it requires state engagement because the free market will not be able to deal with that. It will leave too much risk to the society if we are not going to going to treat the poor people. You might have read some of the article report. Early on, before Congress took action, in the United States, people have to pay the test. And the test costs $3,000 US. That's outrageous. Eventually, the Congress passed a law that mandatory covering of the testing and treatment of COVID-19. I also want to emphasize, government need to invest in more aggressively containing the spread of the disease. Because if the government do not invest more on contact tracing, on isolation, on testing, these are effective measures to contain the spread. And if the government doesn't do enough job, then many countries, including United States and Chile, will be in this lockdown state for much longer. And the longer we are in this lockdown state, people are going to suffer, the economy are going to suffer. So the only way to reopen sooner rather than later, and also to help rescue or reactivate our economy, is to be aggressively investing in containing this pandemic.
Thank you. So I have other 5 questions for you so far. So Juliana is asking, what human behaviors do you think will change forever after the COVID-19 pandemic?
I'm not an expert in human behavior, so I can only speculate. The one major human behavior change is people will suddenly discover, wow, I can be isolated from the rest, physically isolated from the rest, and still doing much of the function. And I don't know whether that's a positive or negative impact, but many people will adapt because, for example, my wife and I, we have been staying home for 6 weeks. And my work has been actually far more busy than before the pandemic. And of course, not everyone is so fortunate to still be able to stay home and work, because I know so many people lost their job. And that will be very hard. So in terms of human behavior change, there will be a negative mental health impact, that's for sure, for many people. And particularly people who lost job, or who lost investment, or who lost their loved one to the disease. That's going to be a huge, and many society are going to have to deal with that. address that issue, mental health issues. And apart from that, that's going to be a different new world we encounter.
Thank you, Dr. Chi. So, Camila, thank you so much for your time to do this talk. And she's asking that, given that culture of the country is very important to face COVID-19, how do you think countries that do not have the same social solidarity can face the pandemic?
The countries that have lower level, and again, social solidarity is not a black and white issue. It's not either or, it's a degree. Some country has a high degree of social solidarity, like Taiwan, particularly when they experienced SARS before. And some country have a mix, such United States, have a mixed solidarity. And with that mixed solidarity, you're going to see a mixed result. Well, some people are willingly complying to the stay-at-home order. Other people, you might also have seen the news, protested that they want to go back to work, they want to reopen. And so the US is a federal system, so you're going to see different states have different criteria, different timing of the opening. And some of the states that prematurely open are going to suffer. So that's what we are afraid of, but it may likely happen in the United States. I know Chile just went through a major protest in last October, and I don't know the climate now when facing with this pandemic, because the grievance from the protests are still there, and now the whole country have to unite together to face this very horrible pandemic. And I don't know to what extent that people held grievance in Chile and work together during this difficult time. And after this thing is over, to resume reactivating those issues.
Mm-hmm. And here is a question that it relates with what you just said. So Magdalena is asking, what do you think about the idea that COVID-19 will strengthen the democracies of the countries?
I didn't hear one word clear. Well,
what do you think about the idea that COVID-19 will strengthen democracy?
That is a mix, a mixed consequences. One potential negative impact that many democracies are afraid is because the effectiveness of controlling this pandemic is relying on delegating more power to the government. And therefore, there's a lot of concern in the European Union, in the United States, in Asia, and in South America about when we delegate so much power to the government, will government still retain that kind of power after this is over and therefore erode our democracy? I would like to use Taiwan as an example. Taiwan is among the highest level of democracy based on Freedom House report of the scale of 100. I think Taiwan got a score of 92, much higher than United States. United States got a score of only 87. And I know Chile also got a very high score on that Freedom House report. Taiwan is a full democracy. And despite that, during the pandemic control, the command center has a lot of power to coordinate all ministries. Taiwan shows the world how a country can maintain high level of transparency, democracy, while effectively control pandemic. For example, Taiwan's command center hold a daily briefing. And that daily briefing lasted about 40 to 50 minutes. And I've been watching that every night because that's Taiwan's afternoon. And they're very responsive to the journalists' questions, the media question, and the general public questions. And that shows a very high level of transparency that when they're going to make a new regulation, they explain why the necessity of this new regulation or restrictions. And then they communicate with the media daily. That's a daily briefing. The media publicize. The media can also criticize the government policy. Then the government have to defend why government are making those policies. And as a result, despite there are still lots of criticism of government policy, but Taiwan's command center, particularly its commander, who is also Minister of Health and Welfare, is the person that's the most popular now in Taiwan. And no politician or public figure ever gets such public popularity. His public support, public approval rating is 92%. Taiwan ever get that high. Also a positive model of how, despite the consolidated power during control of the pandemic, the government can still maintain high level of democracy.
Thank you, Dr. Chi. So other two questions, we are running over the time, but these are really good ones, and, and we want to know everything that you can we can get from you. So Dr. Xiao Shou is asking, since there is so much uncertainty of the testing, whether the viral genome through PCR or the antibodies, how do we use them effectively? For instance, if hypothetically a community has 80% positivity, does it mean that isolation is no longer meaningful?
That's a good question about the sensitivity of the testing, particularly the PCR. So far, PCR among all testing shows the highest sensitivity. If the country has enough resources, such as Taiwan, they use a very conservative procedure. For example, for anyone in part of its precision testing, that if a person has a contact history with a confirmed case, they will conduct a PCR testing, not just once, twice. So the person will have to be pronounced negative only after 2 consecutive negative tests. And many countries are doing just one, and that they will be leaving out some of the false negative. And in terms of declaring a patient, a confirmed patient is cured, use the most conservative process. So if a patient is confirmed and being treated, and to declare that patient is cured, the patient has to go through 3 consecutive tests. And those 3 consecutive tests spaced out by days, not in the same day. So they have to do 3 consecutive tests, has to show negative in order to declare this patient is cured. And this is also the reason, on average, a confirmed patient in Taiwan has the longest hospitalized because of that conservative criteria for pronouncing cured. This is not a complete answer to Dr. Zhou's questions, but probably partially answer that, depending on how the government, how the health authority conduct that testing. And of course, the other important factor is to examine the quality of the testing kit, as the quality of the testing kit varies. For example, we have seen report in Spain and in Netherlands that they imported testing kit that has only 30% sensitivities, and they have to reject those testing kits.
Dr. Xie, I think that this one is kind of related to what you were talking now, but Edwin is asking, well, what methods does Taiwan use for precision in identifying new cases of COVID-19?
Okay, the precision has multiple measures, and one of them is quarantine. And not only quarantine, for those who are suspected case, particularly in my statistics, it shows during February and March, those visitors, particularly overseas Taiwanese who return, they are under mandatory but home quarantine. They're not quarantined in a hospital or in an institution. They're quarantined at home. They have to mandatory download an app in their cell phone. And with that app, the command center can trace their location. And their location, with that app, allow those people who are under quarantine, their cell phone to send signal to the command center every 10 minutes. And if for 20 minutes, the quarantine person did not send cell phone signal, for example, if the person turn off the cell phone, then that cell phone will not send signal. So if for 20 minutes they did not receive signal from the person, the government immediately send a health official and local government official to visit the person. There has been a few cases, a person violated the quarantine, went to public places. And then usually when people go out, they will turn on their cell phone. So the government actually trace those cell phone signals. And then in those few cases, the person violated the quarantine because the government traced their signal, and so they identify all the public places, even public transportation, such as train, on which train, which bus this person has been to. Then they immediately announce that to the general public. They protect the privacy of the person. They didn't announce the name or information of the person. They only say there's one confirmed patient on what day, what time visited this restaurant or this shop. If you ever been to those places, you have to be careful, watch your symptom, your health. And then for a few people who actually say sit in the same restaurant for a longer time, this will be a high risk, and the government will test them. So this is the process of precision testing. Using the so-called digital electronic fence, we were able to identify who have been exposed to confirmed cases.
Carla, okay. So, Dr. T, just your final thoughts about recommendations for Chile. What are your 3 main recommendations for Chile?
Well, I visited Chile 3 times. I really love Chile, and I really hope Chile can put this pandemic under control. And my recommendation, similar with what I just discussed earlier in my last few slides about how to prepare for reopening the economy, is to, well, first of all, I should say in my comparison slide, Chile is doing relatively very good job in terms of a relative low number of cases and low number of deaths. And I would recommend Chile to keep on a good job and to step up the testing, contact tracing, and isolating the confirmed cases or quarantine the suspected cases. By the way, there's a 2 technical term that has a distinct definition in epidemiology. Quarantine is for suspected person who's suspected of the infection. Isolation is for confirmed case. And so to effectively suppress the spread, the government need to effectively identify what the suspected case, what the confirmed case. The confirmed case need to be treated or isolated, and the suspected case need to be quarantined, and you don't have to institutionalize to put them in a hospital or in certain place. You can do a home quarantine. That's the measure Taiwan has been doing. By aggressively doing those works, the case will further bring down. And I mentioned earlier that the daily new cases in Chile is between between 40 to 80. That can be further bring down, ideally, to single digit that before the country can safely open. And then also, as the country is preparing for reopening economic and social activities, I also, in my slide, I also mentioned about the measure. The reason a country can reopen the economy is because the cases are relatively low. When the cases are relatively low, you have the resources to do contact tracing and test all the possible contact to contain them, so they will not continue to spread. And then we can maintain that low level of infection and will allowing the economy to gradually open. And I have confidence that the Chilean government and people have the capability and the resources and determinants to do that.
Thank you so much, Dr. Chi. We are very happy of having you today here at the University of Chile, not physically, but in this webinar. So before we finish, Veronica Pizarro, our director from the School of Management Control and Information System, wants to thank your participation. So Veronica?
Thank you, Alicia. Thank you very much, Dr. Chi. The topic discussed is of great value for the participant in this meeting and to our faculty and students. Thank you, everyone, for your participation.
Thank you, Verito. So thank you so much, Dr. Chi. I hope we can see you again and you can keep having some talks for us, because it was really insightful, everything that you talked today. We want to thank to everyone that participates today also coming to this webinar, and have a great day, all.
Thank you very much, Alicia and Veronica, and everyone who was listening to my talk, and wish you stay safe and well. And I hope in the near future, I will get to visit University of Chile again soon.
Yeah, we hope that too. I hope we can see you soon. Okay, so thank you so much, and thank you for joining us today. And bye-bye. Have a good day.
Bye.
Gracias.
Gracias a todos.